Hello, greetings. Today we're going to talk about the causes of high blood pressure or hypertension. To treat any condition, we have to understand what are the causes. And this is particularly true in cases of high blood pressure, because there's many causes of high blood pressure, and only when we identify what these causes are can we properly treat them. So let's go through these causes. 2 of them are mental, psychological, and 3 are physical. The first one is toxins in the colon. This comes from years of constipation, creating a type of autotoxicity where toxins end up recirculating through the body and then ultimately restricting the arteries and even contributing to inflammation in the arteries. And of course, the treatment here initially would be to treat the constipation, improving the digestion, improving the elimination, and taking the pressure off of the colon and reducing down this continuous state of autotoxicity. Second cause is stress, anxiety, fear, insecurity. Of course, now this has been called a white coat syndrome, where someone goes to a medical doctor and their blood pressure goes up, and then when they're home, their blood pressure is down. So this type of blood pressure usually fluctuates with bad news or stress or tension, and should be treated more with nervines, relaxants, sedatives, adaptogens, nerve tonics that support the nervous system. And we should focus on improving sleep, reducing stimulants in the diet that create anxiety and heart palpitations and ultimately higher blood pressure. The third cause is poor digestion in the small intestines, poor absorption of nutrients, various types of indigestion, which are seen with symptoms such as gas, bloating, acidity, heartburn. Well, this poor state of digestion creates, again, toxins in the small intestinal area, resulting in malabsorption, and these toxins are getting into the system again, creating inflammation in the arteries, and this type of toxicity taking place makes the blood more viscous and thicker, and this again pushes up blood pressure. So that's why digestion is so important in managing blood pressure in most cases. And the next psychological or mental cause is hate, anger, envy, jealousy, this type of rage that some people can have, and anger and short-temperedness quickly pushes up blood pressure. And people can live in a state of anger, just like people can live in a state of stress and anxiety, keeping their blood pressure up continuously. Or in case of stress and anxiety, it can fluctuate up and down, but in the case of anger, the blood pressure can be maintained quite high, and this can be the main cause. Of course, red meats, alcohol, and these type of substances increase our kind of rajasic or aggressive nature and increase these emotions of anger and jealousy and envy, and even contribute to violence. But in this case, high blood pressure, which is evident often in a red skin, red ears, veins on the side of the forehead or the temples, or even veins on the top of the forehead become visible, and even redness in the eyes. These are all signs of this type of anger and high blood pressure. The next cause is excess stomach mucosa, often evident by low appetite and poor digestion. This mucosa in the stomach usually leads to low stomach acids and then poor digestion, which creates particularly poor digestion of fat and protein. And this makes, again, the blood thick, increases triglycerides. And this is often coming from, excess starch, carbohydrates, glucose, and this increasing the triglycerides. And this, of course, restricts the blood vessels and increases the blood pressure. The sixth cause is poor kidney function. This can lead to pressure in the water metabolism system of the body, because of blockage in the kidneys. This could be kidney stones or just poor kidney function due to past toxicity or excess medications, or even too much synthetic vitamins, blocking the flow of water through the kidneys, this filtering system, creating pressure in the body, creating pressure in the liquid system of the body, and then pushing up blood pressure. Often these people aren't sweating very much, so encouraging sweating takes the pressure off the kidneys, improving the kidney function by flushing and cleansing out the kidneys helps. Often we can see people like this are getting up at night to urinate as well, and have difficulties in flow and having to go multiple times to urinate in the daytime. So unblocking the kidneys is the main line of defense. Now, of course, in herbal treatments, there's many herbs that are known to help to improve cardiovascular function, lower blood pressure, and relax the heart, even the heart muscles. But these should be combined with herbs or other treatments that are addressing some of these causes, whether it's poor digestion in the stomach, the small intestines, or constipation in the colon, or blockage in the kidneys, or stress or anger. So you could have multiple causes to your blood pressure, and you should identify these, and these should be addressed individually. I hope that helps you better understand your causes of high blood pressure to have a more successful treatment. Thank you. I sincerely hope you learned from this video and benefited from all the information. This knowledge is not my knowledge, nor is this information new, but part of the ancient healthcare system called Ayurveda, the science of life. I hope my videos explaining the Ayurvedic approach in a simple and clear manner helped you to overcome your health issues. However, if you have a complex or serious health condition, I highly recommend that you contact me personally so I can meet with you here in my clinic in Ojai, California, or in an online conference call, so I can properly diagnose your condition and provide you with an individualized diet and custom herbal formulas. Please subscribe to my YouTube channel below and visit my website for more information, appointment fees, upcoming events, and my schedule, and I wish you the best of health and happiness.